Welcome to this meeting of the Social Work Services Committee. Claire, can you make the Sederunt apologies, please?
Chairman, apologies received from Councillors Blake and McCutcheon. We're missing Councillor Carruthers, Maitland, Tate and Wood. Does anybody know if these are apologies? Yep. 13 members present.
And positive from Councillor Wood. Okay, members of any declarations of interest? Jim?
It's not so much a declaration of interest, Chair. I have a hospital appointment turn at 3 o'clock, so I'll be leaving whether the meeting's finished or not.
Okay, I'd hope you'd be leaving at 3 o'clock as well. Thanks very much. That'll focus the mind, Jim. Thank you. Right. Okay, we move on to item 3, the only item on the agenda. The Social Work Services budget for 2013-14. Report by the Interim Chief Social Work Officer. Sean, I believe Alan's here to take us through this, is that right?
That's correct, Chair. Thank you.
Okay, Alan Montefort, thank you.
Thank you, Chair. The report before members today includes the detailed activity-based budget for social work services at Appendix 2 and at Appendix 1, the budget process that was agreed previously by full Council. The activity-based budget for social work services in itself indicates a net controllable budget of some £78.61 million gross expenditure, though is £107.99 million. The income from client contributions, grants, fees and charges contribute some £29 million. The controllable budget is dispersed and set out over the 11 areas of service, and throughout the activity-based budget document itself, each of the service areas sections explains the resource, the budget and the service that's delivered. In terms of the gross expenditure, 23 million of that is in staff costs, some 21% of the budget. This represents a much lower overall expenditure than other council services, and the extent to which social work services budget relates to the purchase of care from external providers. The 6 sections in activity-based budget covering adult services is divided into a number of sections to reflect the fieldwork and assessment, so the main staff costs for adult services, with the other service areas reflecting the direct service delivery. The budget reflects the increasing demand in particular services and demands that reflect the demographics of Dumfries and Galloway. For example, the gross cost of home care across the different services and activities within social work services is some 27% of the gross expenditure, just over 29 million. A number of service pressures have been identified in the social work budget review that was presented to Social Work Services Committee on 20th of June, and these pressures are reflected within Appendix 2. The identification of potential savings in relation to these pressures and the increasing demand in the service will be undertaken and progressed through the budget process, led by the Interim Chief Social Work Officer with colleagues from the Senior Social Work Management Team, supported by finance colleagues. However, it's within the report, at 5.6, it clearly identifies key legislative and policy drivers that will impact on the service beyond 2013-14, and these are outlined in the refreshed social work business plan that was approved by Social Work Services Committee on the 20th of June. They include the Changing Lives report and 21st Century review of social work, the Commission on the Future Delivery of Public Services, social care self-directed support legislation that comes into effect as of the 1st of April of next year, and obviously the integration of health and social care. But beyond that, we have new legislation in terms of children and young people, and an expected outcome of the consultation and the redesign of community justice. The staff resource across the service it varies depending on this area of service. The staff group includes a number of qualified social work staff who are required to register with SSSC, the Scottish Social Services Council, and a number of business support staff. As you go through the activity-based budget, you'll see the staff resource easily identified in each of the service areas. Staff carry out a range of duties which involve mainly statutory duties and obligations that the Council is responsible for, including public protection, child protection, adult support protection and the management of high-risk offenders. the work in relation to looked after children, criminal justice, social work, and a range of responsibilities for working aged and older adults. In recent years, as a result of a range of demands in the service, the social work service budget has faced a number of challenges, and this has been rehearsed and discussed at the previous Social Work Services Committee. The document itself is in its second generation of presentation, and we look at future reports to be developed based on a series of reviews that are were outlined at the last report to committee on 20th of June. As the funding available to the Council over this period is likely to reduce, those reviews will be undertaken and reports provided through the Interim Chief Social Work Officer and other members of the senior management team to committee, with each of those reports considering a number of policy changes to address the increasing demands and pressures on social work services, and each of those reports will contain a number of options for committee to consider. I'm happy to take questions on the report, but the recommendations are clearly there to review and agree the social work services budget for 2013-14 is detailed in Appendix 2.
Okay, Alan, thank you. Before we go into session, just remind everyone, as always, it's been recorded. I think I'm about to actually tell you that. So we are where we are. Richard?
Thanks, Chair. We've certainly got quite a lot of information in all the sections within social work, and we'll probably go through each one probably. But on the summary of the budgets on page 11, there are also holistic costs which perhaps we should be looking at as well. We're looking at how the parts work, but we're not really looking at the whole of the social work works together. And we've got a whole list of things there which perhaps we should get a report back on. Staffing cost overall, is there a way which we can integrate the different sections within social work so that they work better together, there's less duplication, there's synergies, sharing admin, make sure there's no duplication. And in the same way, are we working with other parts of the council to share resources and save money that way? Property costs, I think also that we are spending a large amount on property costs. Maybe get some details how we're working to cut these, how to use less buildings, cut cleaning costs, etc. Transport, we have made significant savings there, but perhaps there's more savings to be made. And supplies, services, and administration, it's a huge cost there, and perhaps we need to look at these as a whole and see if we can make savings there. Payments to other bodies has frequently been talked about. The question I'd like answered at the moment is on the fees and charges there. We received, the outturn was 4.1 million in 2012-13, but we were only budgeting for 3.25 million. Is that something that would be less of a budget pressure if we made that the budget for this year the same as historically we have raised?
Okay, I think to be fair to Alan, if you've got specific questions, can we give him a page number and where we are on the page? That's all on page 11, yeah. Alan, or Paul maybe, I'm not sure. Okay, Paul, can you help with that?
On the summary, the budget estimate summary, there's a fee for fees and charges, which is 2.42 million for next year, when actually the outturn in 2012-13 was 4.149 million.
Yep, the budget for 13-14 reflects the current sustained fees and charges we collect on an annual basis. There were one-off amounts in 12-13 that are included in the outturn figure. I can provide you with details of those one-off figures that were secured in 12-13 that are not ongoing, so I can make sure you get that information provided.
You happy, Richard? Yeah. Thank you. Jim?
Thanks, Chair. Just to an observation to start with on page 19, where we say that kinship carers should be viewed as equal to foster carers in the role that they undertake, and yet I see we still pay them only £83 compared to £130 to £225 of their foster carers. I presume that the Council will be looking at that again, at least I would hope the Council will be looking at that again in the future, because clearly that's an anomaly. And if we are saying that we view them as equals, we should be paying them as equals. And my other question is on page 26, and I don't expect a response today, so you don't need to maybe look for it today, but we've managed to get the cost of home care per hour down from 15.69 to 12.52 on average, and I don't understand how on earth we can get prices down when this is now a year old and everybody's looking for salary increments. So I'd be interested to see where we commission home care from, if it's not the Council, and what we pay them, because we'll have a whole plethora, I would have thought, of providers across the region. And I think all members would be interested in such a breakdown. It'll not be a huge task, I wouldn't have thought, to tell us who all we commission home care from and what we pay them, and then we'll be able to compare that with other authorities, and indeed what the Council pay currently.
Yeah. Paul, can you take that, or Alan? Yeah.
No, I think that information could certainly be provided. Also, it's important to recognise that a review of the care at home strategy was agreed by the committee at its last meeting, so there'll be quite a significant amount of additional information coming back to members in terms of that particular spending area, and we'll make sure that's included in that.
Grateful to you, Chair.
Okay, thank you. I do know that one service provider, at least one major service provider, actually made a point to tell me they welcomed the process because it made them a leaner and better fighting machine for the rest of Scotland. So maybe we're leading the process for the rest of the country.
I think the problem with that is, Chair, we know one that says that they're being put under severe pressure by the Council. So there are two sides to every coin, which is why it would be nice to get a report back outlining who all we deal with and what services they provide and how we manage or arrange their hourly rate. I think that would be something all members would welcome.
Jim, your point's well made. Anyone else? Willie?
Yeah, Chair, I don't know what kind of task we're being presented with today in terms of the activity-based budget. We have a number of papers, but if I turn to Appendix 1, and basically this is laying out, as I see it, you know, a process from June through to December, but there's no indication of the actual savings that have to be identified, because it marked against that on the June to July levels of savings sought, e.g. percentage reduction through service reviews. Now we've heard from Richard Brodie, you know, in terms of transport and different things. If there is a level of savings that can be already identified, then that should follow naturally that there is savings in there, so we'd be looking for them anyway. But, you know, from the recent seminar that we attended, the increased demands are chasing a reduced funding source. And yet nowhere have we identified actually what we are striving to achieve in terms of the savings, so that we can then prioritise what the areas, as the recommendations say here in 2.1 and 2.2, as to what is sacrosanct and we do not pursue. And Jim touched on kinship carers. I have recently, no later than this morning, emailed to Sean an issue where kinship carers are not being paid on 2013-14 to the level that we have set of £80, and the council always runs the risk of some of the kinship carers actually taking the council to court on equality of payment with that of foster carers and so forth. So it does run the risk, almost equivalent to the one that the employees took the council to. So that's always a risk in terms of kinship carers and the allowance being paid. So within the report and the task that we're being asked for today is to prioritise where, we do not want to. And I would say a number of areas, and indeed, to a recent meeting I attended with Alan, in terms of respite care and the provision in the West, there is a huge issue, and I'm hoping that there will be shortly a report come forward on that to this committee to address. So again, that could be increased spending on 2013-14 budget. So, the figure we still may not have wrestled the budget in terms of keeping it within the budget constraint of 13-14. And yet we're being asked to see where do you identify where you do not, which services are sacrosanct. In my opinion, I think it needs to go back to policy and resources, and to say that social work services may have to be protected. And again, we may not be able to meet a level of savings on the demand that's being driven by people out there in terms of social services. So we need to address this issue, as I see it, in the first instance, before we go anywhere.
Okay, Willie. Paul, can you take that?
Thanks, Chair. Certainly elements of it. One of the things we discussed at the last meeting of this committee was a concern that in terms of corporate budget setting for the last couple of years, social work have almost been left to the side to an extent in terms of there's not been any savings taken, but there also hasn't been information put to members in terms of the various pressures that the service is facing. And one of the things that I think all members were quite clear on and were quite comfortable with and supportive of was we need to change that, and as part of the corporate budget setting process going forward, we need to recognise both the demands, both demographic and other, on social work, but also at the same time recognise that social work should also be identifying and securing savings to help address the impact of those demands, because obviously the amount of money available to the council is reducing rather than going up. And one of the main challenges I think we've got at a corporate level is how much of the council's overall budget should be attributed towards the social work service department, and that's an issue for corporate prioritisation. But just in terms of the point you're making on the prioritisation of services today and which ones should be protected, that's not actually the intention of today's report. The agreed full council budget process is that the committee reviews the details of the 2013-14 budget to inform their thinking, but it's for individual political groups to then directly liaise with the service department in terms of setting out the priorities and where they look for them to make savings. So that's not something we'll be looking for the service committee to do this afternoon.
Okay, Willie.
Yeah, just to come back on one point, where I think Paul did say that we all agree. Well, I have never been comfortable, and notwithstanding, that for the last 2 years, social work has not contributed. I think there is an issue there for corporate, through policy and resources or whatever, the budget process to say, these are demand-driven, this is a demand-driven budget, and we've got to look seriously as to whether we can find, because we didn't succeed in last year's to bring it within, as I understand it, to bring it within a cash limit budget, and we're up against it again on 2013-14, and I've only given you 2 examples. So I am not sure that I would be comfortable, without that wider debate as to whether it's feasible to look for those savings within social work.
Okay, just for clarity, the social work budget is actually needs-led, not demand-led. And I appreciate semantics, Willie, but you know exactly where I'm coming from in that. I've got Ian and then John Syme. Was it John Syme? John Martin, sorry, after that.
Yeah, thanks, Chair. I think you just made the point that I was going to bring up. I notice it's in here in a number of areas. It talks about significant areas of service demand pressure and whatnot. I think part of the problem that was identified at the end of the financial report at the end of last year is it's given us the framework in order to assess those needs and not treat them simply as demands which don't require any further continuous assessment. That's been one of the problems that we've always had, and I think that sort of culture's got to be ingrained, and it's being addressed as a result of the PricewaterhouseCoopers report, and I very much welcome that. My understanding too, and I think Paul's articulated particularly well, that we ask for this process with each service as a method by which we can start informed thinking, and that's exactly what I see this is all about. What I'll take this as is not I don't want to start drilling down to each individual bit. That'll be done over a course of time with officers' help. It's to agree simply that here is a social work budget, and this gives us a framework and able to be starting forming our thinking for next year's budget. But my great hope is that what we have is a situation where it's easier for us now to actually tell whether social services requires more money, because we've never had the information sufficient to be able to sort of determine that with complete clarity. And I very much welcome what has happened as a result of the report last year.
Thanks, Ian. John Martin.
Thanks, Chair. As I say, I've got a wee bit of difficulty with to review and agree the social work budget. As I say, every year we agree this budget and it never comes in. So I'm just going to ask, can we really agree that the budget, given that we're basically being told every other month that we don't really know where the money's being spent, and we haven't got a grip with each of the budget headings yet, and we're being asked to agree something that quite possibly has got to change. As I say, so I don't know if we possibly get a 2.3 put in, that the current we note that the current social works budget review is likely to require amendments to the agreed budget during the course of the financial year.
I'll come back to that in a minute, John. Okay. And you want to say that? No. No, really? No.
The social work budget in particular was subject to a very detailed review round about the year end, and obviously that was reported to this committee last month. So it is as firm an indication as we can get at this stage of where social work will be spending its money in the year going forward. Like all service committees, there is a potential for change during the course of the year, and obviously with social work going through a number of reviews, there's that potential. But I think it is important we do agree the budget and recognise that as the firm estimates for the service department for the current financial year at this stage.
I quite agree with that, Paul, but as I say, every year we come with this and it never comes in on what we say. Like so, as I say, I know the other budgets you may get some, but the social work budget always seems to be the problem budget we have.
Your point's well made, John, but as always, nobody knows what's come through the Irish Street door 3 months down the line here, or something happens. So, have us in tablets of stone. Sorry, John? Yeah, absolutely, yeah. I think this department is actually getting reviewed very, very thoroughly at the moment in time, as you can appreciate, particularly in adult care. So, John Simon?
Thanks, Chair. One area that's always been a concern for looking at savings with vast expenditure has been agency placements. And we've been looking at that over the last few years to try and reduce those, and we've been looking at provision in-house also within local authorities with private companies that are in here looking after kids from elsewhere and seeing if we can use them. And I know we have been doing that a wee bit. But I would quite like a breakdown of these, because I've been getting them periodically, but they've never been really given to this committee, and I think it would be good to see where all the money is spent, because some of these placements come at a vast cost. But the question is what he asked was, another area we were looking at was the intensive fostering scheme, where we were looking for that to sort of save places with specialised foster carers, which again is a big difference in expenditure to going out to placement. I hadn't really heard much about it because it was initially a pilot. So has it been a success, and can we take it forward, or is there not really any savings to be made using intensive foster care?
Alan, you want to pick that up?
The indications to date, Councillor Syme, are that it has been successful in terms of good outcomes for the young people that have been involved in it, and has reduced some of the costs, and certainly has ensured that young people can be retained within the council area. As part of the process of reviewing the policies and how we apply them, it's going to be one of the reports that will come to committee with some of the details that you're looking for and have suggested, and we'll certainly take into account the points you've raised today, but that will be part of the ongoing process as we bring forward various papers and reports to committee to consider how we can continue to deliver good and effective services for children and young people, and that we try to, wherever possible, reduce the need to use agency placements.
I just come back to your last comment. Okay. I know the initial pilot was 3. Is it still looking at 3 placements, or is there any more being used?
At this stage, my understanding is the 3 that have been used, but we need to look to see how we build on their experience and learn the lessons from the carers themselves about how we develop the project and take it forward.
Jim?
It's something I forgot to touch on, Chair, and again, it's not necessarily for today. It's criminal justice, and it's on page 60 and 61, a statutory requirement. And I remember us agreeing a long time ago that there were centres to be based in Stranraer, Newton Stewart, and Dumfries and Mid and Upper Nithsdale. I see the terminology has changed here on page 61 to just say Upper Nithsdale, but I would hope that this is not an opportunity to just abandon the accommodation issue on the basis of a cost-saving exercise, especially when we agreed at planning last Wednesday for the siting of 2 porta cabins at Newton Stewart. Yin, I'm sure, would do your area, and I don't think that particularly expensive, and I know the very location for it. But I'm just concerned that I understood, and I always understood, that an indication was given by the Scottish Government on the location of these centres, and I wouldn't want our one just plucked out as a basis for a saving. I know Alan and I have had long discussions about this, and the statistics that we will be given, no doubt, sometime about how many offenders there are, and although it's reducing, they are still there. And the sentiment is important that the offenders pay back, if they can, in the community where the offence occurs. And certainly, being based in Dumfries and travelling up to Sankirk, I don't think it's an option. I think this centre should be located, but as I say, it's not for today. I just wouldn't want to miss the opportunity to rattle Alan's cage. Thanks, Chair.
Very briefly, I'm glad that the councillor and myself are of the same view that unpaid work should be undertaken as close to the area in which the offender lives. No, we have not forgotten our commitment to this, and hopefully a report will be coming to committee next month in relation to accommodation, and in particular the situation as it impacts on in Nithsdale, because that was the decision of committee that we should do it. It wasn't Scottish Government, unfortunately, who decided where things should be. That was a comment from SWIA saying they were concerned about the lack of provision. What we do have now, even without the provision we hope to develop in Nithsdale, is the envy of just about every other criminal justice social work service in Scotland.
Thanks, Alan. Graham.
Thanks, Chair. On page 9 it says, as the funding available to Council over the period is likely to be significantly reduced, it is readily apparent that significant change in the approach to service provision will be required to address the need to contain spending within the available resources. Social Work Management Team have recognised the challenge and will be bringing forward reports which will require consideration of policy changes to address increasing demand pressures. I presume that work has started, and I hope it will be ongoing, and I'm just hoping that we get some reports soon, because if we're going to make significant changes, we need to address these problems, we need to make them ASAP.
Yes, Graham, good point. Alan, you picking it up again?
I agree that committee on 20th of June, a number of areas were identified to be reviewed, with the reviews agreed that would be undertaken between August and the end of the financial year. So the first of the reports in terms of those policy demands and pressures will be presented, it's planned to be presented to committee next month. But the work has started in a number of the areas.
Willie?
Yeah, Chair, I'm looking at pages 18, 19 and 20. And that starts to lay out the basis of what I was picking up from what the remarks made by Ian. And it's the first time we're going to sit down and actually look at the baseline and how we spend. But in this one, it talks about residential childcare, and it says that we have only one accommodation now being Cairnryan House to accommodate 4 children between the ages of 12 and 18. And my understanding that we could run on a year with children requiring residential care, something in the region of anything between 25 and 30 kids. And the strategy then was to try and reduce that to below the 20. Is this being suggested that we now only have 4 that we need to accommodate throughout Dumfries and Galloway? And if not, what is the actual figure and how many are being accommodated elsewhere, i.e. out of region, so that we can get a handle on that as to what the average figure per year is running at. The other one is children with disability, and they are, rather than demand, let me change the phraseology to needs. Then they are, as I understand it, could be increasing as to the number of children that we need to provide for, and it's not something that perhaps we can walk away from. And similar to, on page 20, is the respite care and what's being referred to as Acorn House, where just recently some 20 plus families are not being provided with the service west of the region, and that was my reference in my earlier remarks to the need for respite or provision west of the region in that respect. So even against this, we are facing serious problems in terms of budget provision and delivery of service. And that's 3 areas perhaps we could get some handle on as to what figures are we talking about here.
Thanks, Willie. I'll just let Sean into that one in a minute. But before we do, can we get an update on the new children's home in Hawthorne Road?
Yes, Chair. The update on the Hawthorne Road is that the building has been completed. We are not going to accept the keys at the minute onto our residential managers can ensure that the building is fit for purpose. I believe I wasn't involved personally, but I understand we had a similar situation with Cairnryan House when we actually accepted the keys, and then we had to do work within the building. So at the minute, the builder said it's fit for purpose. We need our residential managers to go in and ensure it is. So that's where we're at with Hawthorne.
Just for clarity, when you mean fit for purpose, I'm assuming that the regulatory authorities are happy that the building is suitable for children. Is that what you mean?
I mean, that's what I mean, but also mean like health and safety issues as well.
Thanks. So, can you deal with Willie's question? Yeah.
Well, you have many questions, so I'll try and work back to front. In relation to Acorn House, that even though it's based in Dumfries, it is a resource for all of the region. But I accept your point that the west of the region is not well served, and there has been Chief Executive has asked me to prepare a committee report for a forthcoming social work committee. Whether or not, so that's been commissioned. So whether or not that'll be available in August or the one after, I can't say, but it has been commissioned. In relation to the number of children in out of region placements, I couldn't put a sort of a broad term on it, but we're talking between 20 and 30, and some of those will be children with severe disability needs. So they'll be in specialised resources such as the Royal Blind School. We do work with food sector partners such as Chronic, basically prevention's better than cure, to stop kids going into cure. And I think if we look over our figures, go back to 2009, I would like to think that we have reduced the number of children going down the region placement. But what I would say there is that social work has maybe very little control over that, because the children who are going down the region placements will be on statutory orders from the Children's Hearing System, and we are duty bound to put those orders into place. So.
Does that help, Willie? Yeah?
No, it only aggravates us, because we were sitting with between 20 and 30 on average. I think it worked about between 25 and 30. and the objective was to try and get it below the 20 in terms of residential, because while we have to comply with the order, what the order doesn't state is this person will go to X, Y or Z. It's whether we've got the facility to meet that order within the children's hearing, and the objective in the strategy was to try and make sure that they remain within the region. And if it was still to remain high, at least the money was being spent in region. So that was the strategy that was being followed then. And by all accounts to what Sean's saying, then it does not seem that the numbers are coming down significantly to say that we are achieving that in terms of how we deliver. And I take the point, indeed I asked for that report to go forward where the west of the region is serviced as much as that of the east, because a lot of people only avail themselves of the respite because of the distance that they have to travel. So again, that's a further pressure on the budget, as indeed it is to place these children out of region if they're still running at 20. For the very reasons that Sean states, I have no difficulty in that, but it's to how do we provide that within region. And that was the strategy. That's what led, if you like, to the closure of Milton House, in terms of that was expensive to run, and we ended up, so by the opening in Dumfries, we're saying that of the figure 4, then that's well below, it must be running to the figures that Sean is talking about, between 20 and 30. So we haven't reduced that significantly at all.
Absolutely. And just for me, put my tuppence in for a change here. I think we need to understand the diversity in the range of needs for these children. And whilst it might be great to do in-house if we can, or in region if we can, but the reality is that some of these things there only are a limited number of children in the whole of Scotland who are actually going to one place. So, does anyone else get anything else in this? Jock?
Hi, Chair. I was looking at I think most of the other stuff's been covered. I've been looking at the vehicle allowances, mileage, hire and leasing, and fuel costs. Unfortunately, it's the children and families are picked on first, but adult services quite similar. They're all pretty high. Do we use pool cars a lot? And if not, why not? And if we do, are they a lot cheaper than people using their own cars? Another issue I had on page 23 was private contractors, 7 million. Is that for out-of-region placements? This is under the Children and Family Services again.
Alan, can you pick that up?
In terms of the travel costs, yes, social work staff do use pool cars and use pool cars on a regular basis. We also have a number of lease cars that are available to staff within the service because of the level of demand. In terms of travel, the allowances have actually reduced over the piece over the last few years, and indeed the travel budget is to ensure that social work contributes to the cost of the pool cars was top sliced at least a couple of years ago. In terms of the private contractors and payments to other bodies, yes, a significant amount of that will be an agency placement. Just going back to the point raised earlier by Councillor Scobie in terms of the panel will name a particular establishment for a child to be placed in. There is no choice once the panel has made that decision. We do need to look to see how we develop resources.
Thanks, Alan. Ian, sorry, Jock, you come back in yet?
It's on the vehicle leasing. Is that if that's 28,000 a year? Would that not justify getting another pool car for that? Try to reduce costs one way or another. I think that's really what they were on about today. Seems quite high for the hire and leasing.
The 28,000 for vehicle leasing in terms of current costs would be between 7 and 8 vehicles, and accessing those vehicles across the authority, particularly the number of leased vehicles through in the west, so that we can continue to, against the backcloth of the point raised earlier about the number of properties and social work making their contribution to the accommodation estate within the council requires that we do have to travel to visit people in their own homes, and we do have to pick up on public protection requirements, which means we need to access vehicles. And just now, whilst we've got some agency placements, staff are required to travel, and rather than staff trying to use their valuable time to access a lease vehicle, a pool car, then it's very often it's more cost efficient in all terms to actually access a lease. So it's 7 vehicles. So it's not a huge amount, but it's an ongoing process to look to see how we use vehicles and to ensure we get the feedback from our colleagues in fleet services.
Thanks, Alan. I've got Ian, and then Richard, and then Jane.
Just to follow on from the point that Councillor McKee made about vehicles and whatnot, I think it's a thing that in the budgetary process that all services are going to have to look at, is the cost of travel, the way in which we procure cars, whether pooled or otherwise, and the extensive use of car sharing.
Yeah, fair enough. The one thing I have to say in fairness here, there are times when this department needs exclusive use of a vehicle because if an emergency crops up, they can't not go because there's no pool car available. I think, and that's one of the drivers, if you excuse the pun, for that thing. Richard?
Okay, we've got a couple of questions. Still page 11 at the sort of summary. This strategy and commissioning is going to be increasing from 3.78 million, which is the actual budget in 2012-13, to 4.34 million in the next year, which is about an increase of 20%. Does that reflect a 20% increase in need, or is that figure over cautious?
Alan or Paul?
I think it's one of the areas we'll have to come back to elected members with some more detail, but certainly my understanding is that as part of the ongoing review process, and one of the review areas for review will be strategic planning and commissioning. But as I said earlier, we have to rely heavily on our colleagues within strategy and commissioning in relation to the number of commissioned services we have, and there has been an increase in demand. But content to come back with some more detail on that.
Yeah, I think it's fair to say there's a fair bit of activity looking at the separate budgets and separate service areas. Richard, do you want to come back?
The second question I was going to say was the criminal justice services. Obviously, it's a neutral services because we are reimbursed for that. Are we certain that we are claiming all the costs which we incurred in that?
I probably can speak with absolute confidence in that, given my particular strategic responsibility. Yes, we do draw down the maximum amount through the criminal justice grant allocation in terms of Section 27 of the Social Work Scotland Act that's granted to us via the Community Justice Authority for the South West Scotland area. The particular amount that's there includes the clear evidence that we were able to draw down funds that should have been allocated to us in previous years that we were able to realise through some significant activities undertaken by colleagues in finance and myself.
Thanks, Alan. Jane?
Thank you. I think part of the problem with all this is there's so much information, it's quite difficult to know how to use it at to our best advantage. And I think that we ought to continue to try and think about the outcomes for children, as we're all wanting the absolute best. I remember seeing some time ago that the educational outcomes for children educated at home were worse than looked after children who were not at home. Is that still the case? Do you know if that's still the case? Because, we look at these and we must be quite sure that what we apply money to is actually doing the best thing for these children. And I know that's a huge question, but I do think it's quite difficult to know whether we are actually applying money, to what needs to be applied to. And that's only just one example.
Sean, are you wanting to handle that hot potato?
All I would say there, Councillor, is that's obviously an issue with education as well in relation to looked after children. And we have, under the GERFAC, set up a corporate parenting group as well, which should be looking in depth at those issues. So we have a debate regularly with educational colleagues about the needs of all our looked after children as opposed to non-looked after children. Hope that answers.
You okay, Jane? Yeah.
I'll try and pick it through later on. I think that's that. Can I have another question? Would you let me do that? The next question is that we're going to receive information chunked down into area bases, and I just wondered when that's going to happen and how we're going to be able to receive that, because that will also give us a handle, I think, on the property issues, which are not split out here, nor indeed, where staff are, which I'm also interested in knowing, both where staff work and where they're based, and the property they use on an area basis, and caseloads and what they look after. So I'm interested in that.
In terms of the breakdown into localities, as I said earlier, that this is the second iteration of activity-based budgets. We are moving towards greater clarity in terms of the budgets for the localities. There's a clear commitment, even as we move towards some form of integration between health and social care, to ensure we understand the overall spend and the locality spend. In terms of the properties that are available, we have seen some changes and some reductions in some of those properties, and I think it's only right that we provide elected members where it's appropriate with some clear information about where they are, and I would hope that as we develop the reports in terms of key performance indicators to area committees, we'll start to provide some contextual information. That's one of the things that's been requested in terms of the numbers of cases we're dealing with, as well as the outcomes from some of those.
Thanks, Alan. I'll let you in a second, Jim. Can we get an assurance that we can drill down so far, but when we reach a situation where we're actually able to identify a child or a person, that information doesn't go into the public domain? And I'm thinking here, if we've got somebody with a particular condition in Sederunt, for example, and if it was down to areas and there was only one person in the region, then you're identifying someone very clearly. So can we get an assurance that when we're breaking this down, we don't go too far?
That's been stated clearly at, I think, all the area committees where the numbers involved are so small that they might lead to an individual being identified that they wouldn't be reported other than on a council-wide basis. But the vast majority of the information we should be able to provide both the budget and the needs that cause that budget and how that budget's been spent to be made available and reported on. But as I say, in this iteration, we've developed a wee bit further because last time round, all of adult care services was in one area. It's now broken down into the fieldwork and assessment and then into the very specific ones.
Thanks for that assurance, Alan. Jim, are you wanting?
No, I wasn't wanting in, Chair, no.
Waving to me.
Try to keep in with you.
Thanks, Chair. Two issues. If we just rewind a wee bit, Sean, to Hardthorne Road. Has it been on the... It's been seems a long time since we gave it planning permission, and according to Dumfries and Galloway Council protocol, I would have thought by the time it got the planning permission it would have been half built, because we've had a bad habit of doing that recently. And the other one was pool cars and lease cars. I'm maybe being stupid here, but can somebody No need to laugh, John. Could somebody explain the difference to me? Because I thought we leased the pool cars. So is the lease car a dedicated car for an officer as opposed to just a pool car where anybody can drive it? And just to go back to Hardford Road, Sean, if I could, is it going to be a long time before it's in use, or is this going to be rectified fairly quickly? Because there's no point in having an asset if we can't make use of it.
I think I've got 2 folk fighting what to answer here, but Sean, you want to go?
Well, I'll take the Hawthorne Road issue and Alan can take the car leasing issue.
Right. And it's good night for him and good night for him.
That's right. Councillor, I'm not up to date with planning, permission, etc., but I'm working on the basis that this will not impact on the opening of Hawthorne Road, as Hawthorne Road, as I say, it's just ironing out the ditches. I would expect to be in very, very soon. One of the things we have to do going forward is to identify staff, but more importantly, identify the children who will be going in there, because those children at this time will be in placement somewhere else. So it's quite important that we look at those placements as well. So that is work which is actually ongoing at present.
Yeah, just if I could just come back briefly on that point. It just alarmed me when you said you weren't accepting the keys, because to me that means that there's somebody hasn't done the job right. And this was a brand new build, so hopefully it should have been A1 when it was ready built for purpose.
We will accept the keys, but we're not going to rush into accepting keys until we make sure the building is fit for purpose. And the only way we can do that is get our residential managers in to give it the once over, health and safety folk in, and the care commission. But we're not talking a long time, Councillor. But you're right, it has been a long time in coming.
I thank Sean for leaving me with this one. The terminology, they are indeed all leased. The pool cars are leased. Pool cars, though, it's a general pool of cars that are available to all services, and it was proportioned. The cost was divided up depending on previous use and mileage. Certainly, the number of mileage claims that I've signed off on, and managers I'm responsible for have signed off on, have reduced dramatically. We do have a number of lease cars that are dedicated to particular services, and despite the fact that one of the cars is sometimes referred to as Alan Montefort's car, I can assure you it's not solely for my use, despite the fact that it's clocked up a few miles and having to come through here to Dumfries from my base in Stranraer. But in a serious point, no, the lease cars are dedicated to particular services for particular purposes. So picking up on the point that Chair made in terms of having to respond quickly, and the point I was making as well about transporting families to agency placements, for example, and to cover some various things. And then going back to the point raised about criminal justice social work, all the lease cars that are used by criminal justice social work for the programme delivery team that we have and others are all charged to the criminal justice grant.
Willie?
Thanks for allowing me back in, Chair. I'm looking at page 11 of 82. I'm looking at the budget as set in 2012-13, then 2013-14, and comparing. And the children and families, there's been a steady decrease from 16.1 to 15.9, which is not all that significant. Then I look at page 21 of 82, and over the period dating back to 2009-10, there was a steady increase of kinship carers from 157 to 317, and then a sudden decrease on 2012 to 2013 of some from 317 to 163. And from the discussions that I alluded to earlier, if we look at the budget estimates for 2013-14 and then 14-15, that there is an increase to back up to 16.12 and indeed higher than that of 2012-13. So the estimates, you know, and then we look down at the other estimates against 2014-15, then there's a steady increase, and it's increased from 78.6 that was referred to earlier to 79.36. And it comes back to my earlier remarks, you know, it's against the estimate figures of 79.366 that we need to know what is the estimated figure in terms of the savings, because that has an impact on all the services as outlined here. And I only bring children and families where on this year, and I've spoken to both Sean and Alan, where we are not meeting, if you like, people who are kinship carers and who are waiting to be paid. And there is apparently a difficulty there. So it's to try and make sense of some of these figures, because if it's from 2009 going through the consecutive years to 2012-13, is there a reduction in the number of kinship carers, or indeed an increase where we are not meeting our needs, which I would see as a demand?
Picking up on that particular point about the numbers of children and families in receipt of kinship care, I give a commitment to go back and just double checking that figure. I know there may be a slight reduction caused by the number of children who may have achieved the age of 18 and no longer been in receipt of kinship care, but it is a real issue and challenge for us, and it's already been identified that the increasing number of children who are in receipt of kinship care, but there has been that increase. But I will go back and come back and advise committee in terms of the actual numbers in respect of that. Certainly the figures that we're working on for 13, 14 and this year indicate that the numbers are closer to those shown in 2011-12. So apologies, I can only assume there may have been an error on that, but we'll come back and advise committee.
Yeah, Sean.
It's just to say that there will be a full kinship care report going to August 22nd committee, which will cover all those points, and we will drill down more on the figures.
Yeah, Chair, I think I spoke to you at the end of the last meeting, or if not, then subsequent to a number of meetings, because running alongside this, and there was a commitment given by yourself that we would resuscitate the cross-party in terms of kinship carers, the lobbying that is required in that, and that's a significant error, if that is an error, for us to make sense of in the report. And running alongside this, and Sean refers to in August, I thought when we had that sorted at the last meeting, we've got people out there who are not being paid, who have been approved as kinship carers as we speak. And I would hope that we could deal with that issue today, if that is at all possible. Chair, and I'll put myself in your hands on that one, because these are kinship carers who have been approved and should be paid. And I thought I cleared that at the last committee meeting, but obviously not from the practice that's
Councillor, we're actually straying into what is clearly an operational matter, right? Although the individuals concerned, yes, we're talking about individuals. Now, if that's not been done, then if you can take it up through the proper channels, through the Chief Social Work Officer at the end of this meeting, I'll give you an update on the issue about the kinship care cross-party group. I'm currently waiting from advice from the proper officer about the makeup of that group, because it was set up under a previous administration, and we need to be absolutely certain who the membership's got to be, and who and what they are representing. And you get my drift. Okay, so that will be happening very soon. Okay, and I did say it would be before the recess, and we'll try and get it in before the recess. Anyone else? John, I did say I'd come back to you. You had some suggestion for a...
No, I understand about the change, all the budgets change, like, but as I say, I think we really, as members, like, we've got to put a note down that the current social work budget review is likely to require changes to the agreed budget during the course of the financial year, because there are usually major changes on the budget in the social one.
With that in mind, we'll move on to recommendations, yeah? We've obviously received the presentation. We've reviewed the social work budget for 2013-14. We agree in its present format, and we'll add a 2.3. Claire, can you just read out what we've got to add?
You want an additional 2.3 to the effect that you're noting the current social work services budget, which is under review, is likely to require amendments during the course of the financial year. Yep.
Yeah. Okay, are we happy with that? Richard?
Yeah, just like, I agree with those, but we'd also like more information on the holistic costs of the social work department, which is contained in the top half. The second box on page 11, which is the staff costs, the property costs, transport, supplies, services, payments to other bodies, fees and charges. So we've got the individual ones, but we don't have the overview on these topics, and I'd like more information on there and how we're trying to make savings on that.
Okay, if you were to get an assurance that they would actually be included in all the service reviews that are coming forward, is that sufficient for you? Ian?
I think it's appropriate. It could be brought forward through the service reviews, but just advise, I asked for and got a detailed breakdown of all these costs during last year's budget. So those should be available by service, and I think any member can ask for them if what was available to me last year is available again.
Thanks, Ian, for that. That actually galvanises me, because what I'm actually thinking here, it shouldn't be up to individual members to ask individual questions. If that information is available, we should all get it as a matter of course. So is it a massive job to get those breakdown figures? Bear in mind, this is no the end of the process today. This is 2013-14 is in place. It's the budget review for 2014-15, and that we're talking about here. And also to consider how we're going to try and keep within, well, we're going to keep within budget. Sorry, I'll rephrase that. Within budget this year. So, Paul, can you get that kind of figure for all the members?
Happy to try and provide any additional details that members are looking for, Chair, but I think I'd probably ask for clarification on what's actually required. Each of the sections within this document obviously breaks down the staffing budgets, the number of staff and relevant grades, the property details, things like that. So I need to get a bit more information on what additional further information we're looking for.
Shall I do that after the meeting, Chair?
Yeah, I think so. I'm also wondering, I can understand where you're coming from, Richard, because the information is there, but it's not readily available in one page. And to have had the different service areas onto one Excel spreadsheet might have been easier. But we can take that forward. If you're happy to take that back as a report back to you, and copy everyone else in with what the outcome is, I'm comfortable with that. Willie, do you want in?
Just for a point of clarification, Chair, on 2.2, and it clearly reads here, review and agree the social work service budget 2013-14 as detailed in Appendix 2. And we have that in Appendix 2. And yet, on the questions that I've asked in terms of kinship carers, I've made the point that there are kinship carers not being paid because it's exceeding the budget. So, how can we agree the budget as laid out in 2.2, review and agree the social work service budget for 2013, when we've heard from the interim chief social worker that he's coming forward with a report and a paper in terms of where we will exceed the current budget for 2013 to allow the kinship carers to be paid, and then you tell me I've got to speak to the interim social worker at the end of this to have these people paid? I seek your clarification, Chair.
The clarification is quite simple, Willie. That's an operational matter. It's about individual cases. Right? This is a strategic meeting to discuss the budget for the whole department, and it's as easy as that. Right? Now, I'm not belittling or ridiculing your position, because I understand your position and you're right. Right? But it's not for this committee today, right here now, to actually drill down into individual caseloads. Right? So, with the greatest respect in the world, we're moving on for that, and there is a report coming forward, and if you have specific issues about specific service users, then raise it with the Chief Social Work Officer or the service or the manager for that, senior social work manager for that area. That's the proper route, not in here. Okay, so we're on the recommendations here. 2.2, we've got a 2.3. Are we agreeing 2.2? Agreed, thank you. And are we agreeing the 2.3 that was added by John? Yeah, okay. Thanks very much. Okay, so thanks very much for your attendance and the way you've conducted yourself today, and we'll see you in August.
Thank you, Chair. Talk to you now. Anyway, that's the law.